Good morning and welcome to Webinar Wednesdays with SMP. We're happy to have you all here with us this morning. My name is Sunny Lawless and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'm going to be your host for this morning. Presenting for us today is going to be Jean McDermott, our Vermont team lead, and Justin Grimball, who is our Community Outreach Specialist in Vermont. Today, for the July installment of Webinar Wednesdays with SMP, we're going to talk about durable medical equipment fraud. During the presentation, you're welcome to type any questions that you have into the chat, but we will hold those until the end of the presentation when we open it up for Q&A. There will also be a prize drawing at the end of the presentation today. You must have been registered to attend prior to 10:15 a.m. this morning in order to be eligible to win. Before we get started with today's presentation, I do need to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the US government. And if you've never joined us before for one of our webinars, we want to give you a little information about who Senior Medicare Patrol is. Well, SMPs are grant-funded projects, as I said, from the U.S. Department of Health and Human Services and the Administration for Community Living. All grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, the SMP programs are sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. So before I turn things over to Jean and Justin, we do have a quick polling question for you. And today's question is, have you ever received a phone call from someone offering you a free back or knee brace? You'll give me just one moment. We will get that poll launched. There you go. Have you ever received a phone call from someone offering you a free back or knee brace? And the answers are yes or no. And we'll give everyone just a few moments to respond to the poll. All right, we're almost to 70%. I'll give it just a few more seconds if everybody will get those answers in. All right, we're going to close the poll and share the results. So it looks like about only 21% of you have received these types of phone calls, with 79% saying no. So I'm going to turn things over now to Jean, who is going to explain what durable medical equipment is and how fraud might occur with it.
Good morning, I'm Jean McDermott. Thank you for joining us. Let's talk first about what is DME. Durable medical equipment, or DME, is medical equipment and supplies prescribed to you by your doctor that is reusable and has a usable life of at least 3 years. It is usually equipment mainly used in the home and for a medical reason. Examples of this type of equipment are back knee braces, walkers, wheelchairs, hospital beds, home oxygen equipment, diabetic supplies, therapeutic shoes and scooters, among other things. Now, in order to qualify for DME, you will need a prescription from your doctor. So if you need durable medical equipment, you and your doctor can make that decision. They know your health needs and can prescribe DME when medically necessary. Some equipment must be sized so it will work best for you and fit into your home. Medicare only covers DME if you get it from a supplier enrolled in the Medicare program. Next slide, please. Now that you know what DME is, let's talk about DME fraud and scams. This type of fraud and scams have been on the rise. Many people are getting calls from suppliers offering free equipment, or they are getting supplies in the mail without having ordered any supplies or equipment. Examples of DME fraud include billing for equipment you never received. You provide your Medicare number to the DME provider, they bill Medicare for the items, and you never receive anything. Then we have billing for equipment different from what you received. The provider offers to send one thing, they bill Medicare for it, and you receive something totally different. Often, the provider will send multiple braces for different uses, which leads to the next one, billing for equipment that you do not need. And the last one is giving false or misleading information, such as offering free equipment when they are going to bill Medicare. The provider tells you the equipment is free. However, they bill Medicare anyways. Next slide, please. So some potential DME scams that lead to fraud are getting calls or visits from people say they represent Medicare and are trying to sell you products. Many television and radio ads run targeting beneficiaries to get them to order free DME. These ads don't have the beneficiary's best interests at heart, so don't fall for the advertising of free equipment. Then there's aggressive marketing by durable medical equipment suppliers. Don't let anyone persuade you or pressure you into switching suppliers. Talk to your supplier first because you may not need to make the change. Seniors across the United States, and I've talked to people directly in Vermont, are receiving calls from people offering them free back braces and knee braces. They ask for the senior's Medicare number, date of birth, and other personal information. In some cases, the senior never receives the equipment, but Medicare is billed anyways. Sometimes the senior receives the equipment, but it doesn't fit properly, so they are unable to use it and have trouble returning it to the provider. So Medicare ends up paying for equipment they are unable to use. Next slide, please. This graphic produced by the Officer of the Inspector General shows you an example of how the scam usually works. It starts with the conspirators. They own the call centers where telemarketers call beneficiaries directly and they offer free or low-cost orthopedic braces. The call centers confirm the beneficiaries are on Medicare and then transfer them to a telemedicine firm for a doctor's consultation. The doctor and the telemedicine company prescribe an orthotic brace regardless of medical necessity. They then turn around and submit the brace prescription to the call center. The call center then collects the prescription and sells them to a medical equipment company. After the medical equipment company buys the prescriptions, the medical equipment company sends the brace or multiple braces to the beneficiary. The company bills Medicare and pays a kickback to the conspirators. Then the cycle starts all over again. Next slide, please. Another type of scam that has been on the rise is the urinary catheter scam. This involves billing Medicare beneficiaries for urinary catheters regardless of medical need. The catheters may or may not actually be sent. How to fight back. These are really important tips too. Review your EOBs, your explanation of benefits, and your MSNs, your Medicare summary notices for fraudulent charges for urinary catheters. Do not accept delivery of unordered equipment. Be suspicious of any unsolicited offers for free medical equipment, including urinary catheters, and talk to your own doctor about these needs. Next slide, please. Wheelchair scams are another very common type of durable medical equipment fraud. Mechanical and motorized wheelchairs can assist a beneficiary who has a chronic ailment or disability that prevents them from freely ambulating. The power wheelchair industry has grown into an almost $1 billion a year industry. You've probably seen those commercials on TV offering wheelchairs at little or no cost to you. Be aware, the Medicare rules stipulate you must have a legitimate need before obtaining these devices, and a certificate of medical necessity must be signed by your doctor. How the scam works. DME street scammers may approach you to offer a power wheelchair that is a free benefit for having Medicare. This is not the case. The beneficiary must have a legitimate need. Copays and deductibles may have to be met, and the physician prescribing the device must have examined the patient. The cost of these power devices run from $1,500 to $16,000, depending on the model. In addition, accessories may be ordered that are not needed, driving the cost up higher by several $1,000s. Often, a scam artist will contact the beneficiary and use scare tactics. This includes telling the beneficiary that Medicare is running out of money, so the beneficiary better get his wheelchair now, even though it's not needed at this time. Getting equipment now for possible future needs does not adhere to the Medicare rules and is therefore illegal. How to fight back. Don't let anyone talk you into stockpiling equipment for later use. If you do need the equipment, it should only be ordered through your regular family physician who is actually seeing you. If someone calls and tries to threaten or pressure you into something, simply hang up the phone. Be aware that you are responsible for 20% of the final amount, including potentially unnecessary add-ons and accessories for the device ordered. Frequently, the scammers do not explain this, so this can hurt you out of pocket as well. Next slide, please. Here are a few tips for things you can do to stop DME fraud. The best way to avoid becoming a victim of DME fraud and scams is to protect your personal information. You should never give out your Medicare number to a stranger in person or on the phone. Treat your Medicare card like you would a credit card. Refuse and report anyone offering free equipment, supplies, or services in exchange for your Medicare number. If you do make the mistake of giving out your information, reviewing your Medicare summary notice, your MSN, or explanation of benefits, the EOB, is the best way to make certain that no one is using your Medicare number to commit fraud. If you are on original Medicare, you should receive an MSN once each quarter, so every 3 months. If you are on a Medicare Advantage plan, you should receive the EOB, explanation of benefits, after you receive your healthcare services. I'm sure most of you know what those are, but they always start at the top with, "This is not a bill." So if you see any suspicious items on your MSN or your EOB, you must report it. It is very important that you care about what is going on with your Medicare benefits. If Medicare pays for equipment that you've never ordered and never received, When you need the equipment, Medicare will deny it because it shows you've already received it. To avoid becoming a victim of DME fraud, you should follow Senior Medicare Patrol's message, which is to prevent, detect, and report. Next slide, please. And now I'm going to turn things over to Justin, who will review the Senior Medicare Patrol's 3 keys to success. Thank you. Justin?
Hi, Jean. Thank you so much. My name is Justin Grimble, and I'm here to review the 3 keys of preventing Medicare fraud. Next slide, please. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as like a doctor's office or when you go to the pharmacy to pick up your medication. Only carry your Medicare card when you know you will need to use it. And remember, Medicare will never call you to ask for your Medicare number for any reason. Keep records of all medical visits and procedures that take place in a medical and the medical equipment that you ordered. Next slide, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse right in its tracks. Review your Medicare summary notice, that's your MSNs, or explanation of benefits, that's your EOBs. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. All right, now you compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies you did not order or receive. Next slide. The third and final key is to report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report that call immediately to Senior Medicare Patrol. If you have questions about your Medicare statements, call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call Senior Medicare Patrol at our 877 hotline number shown on your screen in those big red letters. Next slide, please. All right. At this point, you might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of our community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive trainings on the basics of Medicare health fraud and errors, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host Volunteer Appreciation Month in April for National Volunteer Week. Volunteering for SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call on our toll-free number, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Next slide, please. Want to stay up to date with the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms, including Facebook in Georgia, Louisiana, Mississippi, and Vermont. We also have Spanish Facebook pages. We utilize YouTube and our podcast, Sip and Learn with SMP, on Spotify, and it's also available on Apple Podcasts. Our state-specific SMP Facebook pages especially are a great resource for older adults and their partners to find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next slide. As mentioned in our previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or to ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach out to older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org. For more information about SMP program in your state, our website can be viewed in multiple languages by adjusting the language tab at the right part of the screen. Next slide. Thank you. I will now hand this back over to Sunny.
Thank you, Jean and Justin, for that information. Coming up next month for Webinar Wednesday with SMP, we're going to be discussing pharmacy and prescription drug fraud and scams. That webinar is scheduled for Wednesday, August 27th at 10:30 a.m. Central Time, so just be on the lookout for future registration information. So now it's time for our prize drawing. Everyone who registered to attend today's webinar prior to 10:15 a.m. this morning was entered onto our prize wheel, and you do have to be present to win. So give me one moment. I will share the screen here with us, and we will see if we can find us a winner. Let's see, let's give it a spin. All right, it looks like, let's see, Miss Cynthia Perkins is our winner today, and she is here. So congratulations, Miss Cynthia.
Woo!
I will be reaching out to you a little bit later to get your information so we can make sure that we can get you that $25 Amazon e-gift card. So congratulations. And let's see, there we go. Get back to our screen. All right, so before we wrap up today's presentation, we do want to open it up to questions. So if you have a question, feel free to raise your hand and we'll unmute your line and you can ask the question. If you have any questions about the program or what we presented on today, which was durable medical equipment fraud. Let's see, it looks like Miss Joy, you have your hand raised. I've unmuted your line. You just have to unmute your phone. Ms. Joy, it shows that you're self-muted, so you would have to unmute your phone. Oh, I'm sorry, it's not the audio isn't working for you. You could type it into the chat if you like, or you can just send me an email after we wrap up today and I'll answer your question for you. I'm sorry, it doesn't look like the audio is working for us today. I'm sorry about that. I'll follow up with Ms. Joy after the presentation. I'm not seeing any other hands raised, so we're going to go ahead and wrap it up for today. This is going to conclude our presentation on durable medical equipment fraud and scams. You will be receiving an email from us later today with a link to a short survey. And we would appreciate it if you would complete the survey just to let the Administration for Community Living know how we did with today's presentation. So we appreciate you all joining. Thank you to Jean and Justin for presenting this information on durable medical equipment fraud and scams. And we hope to see you all again next time. Take care.